It gives me, I'm going to pass this over to my wonderful colleagues that have agreed to be here today. So it gives me great pleasure to introduce the speakers who will be speaking about our mindfulness portion of this event and another very important self-care strategy. So first you will hear from Angie Kingma. Angie is a registered psychotherapist, certified mindfulness teacher, a faculty member of Toronto's Centre for Mindfulness Studies, and the owner of Mindfulness for Health. And on top of all that, she is also an occupational therapist. So she will highlight some of the neuroscience behind mindfulness, how mindfulness can facilitate the prevention of depressive relapse, and talk us through the foundational attitudes. And later she will share some community resources and how to begin practicing mindfulness in every day. We also have with us Jayza Sulit, a neural rehab occupational therapist and mindfulness coach who will share her own personal story of recovery from spinal cord injury through a mindfulness-based stress reduction program. So at this time, I'd like to welcome Angie.
All right. So hello, everybody. It is a great honor to be here and to be a part of this amazing event. I won't go into anything about my background because you guys have already heard a little bit about that. And I just wanted to say that even though I have my own sort of performance anxiety, mindfulness has been able to help me overcome the urge to kind of shy away from things like this, and it's helped so many of my clients be able to not only recover from depression, but also to stay well and navigate the ups and downs of life with more skills. So you may be familiar with this famous cartoon. It's sort of on the internet, and you can see here that this fellow is going for a walk in the park with his dog. And although it would seem like it would be a lovely experience, unfortunately, what happens is that his mind is defaulting to this left thought bubble here, which is paying attention to all the things in his life that he has to take care of. So you can see there's a picture of the mail coming in, probably bills, being late for something. He's got this sad face on. There's mismatched socks. All these things that he has to deal with that his mind is paying attention to prevents him from being able to enjoy what's actually happening, which is to enjoy the walk in the park with his dog. And so his mind is, as you see below him, is full of all these stories and stressors. And the dog, on the other hand, lucky canine brain, doesn't have this prefrontal evolution. All he really pays attention to is just what's actually there, just the trees, the sun, and the experience itself. So, which is really encapsulates what mindfulness is all about, which is being aware of what's happening and trying to sort of drop beneath all of this pull towards all the thoughts and problems that we have in our lives that are going on. And so some people might think that mindfulness is sort of a new thing. I mean, it's really exploded in popularity in the past couple of decades anyways, but it's actually been around for over 2,600 years. And it's become quite mainstream now, so much so that it's made it to the cover of Time magazine a couple of times. This was in 2014 when they were talking about this mindful revolution, this sort of population of people who are trying to find more focus, trying to reduce their stress levels, trying to be more present for their everyday moments, and trying to decrease that sense of overwhelm. Also, there's this leading science magazine worldwide called The Scientific American, which was also really highlighting the neuroscience behind mindfulness and how you can see below here, it's how it changes the brain, boosts focus, and eases stress. And because there's so much science behind this idea, this philosophy and practice, it's really been applied to so many different populations and industries now, such as, here at hospitals, hospital staff are being trained, a variety of different populations of patients are being trained in mindfulness. Also schools, teachers, students, top corporations, like all of the Google employees are trained, Ford, Aetna, GM. It's really helping coworkers to manage their stresses in the workplace. Lawyers, also top athletes, prisons. You can just hear about it being applied to so many different populations. And so people are being drawn to it for so many different reasons. But then the question is it actually possible to change our brains for the better through meditation? Are you kidding me? Meditation? How are we even going to prove that this can change our brains for the better? And so, thank goodness we have all of this modern neuroscience. And the fMRI machines now are able to look deeply into the brain and to see the differences between the brains of, for example, this is a famous monk named Mathieu Ricard. He's been named the happiest man in the world, actually. And this is Richie Davidson. He's done hundreds of studies on meditation and how it changes the brain. And so they look at the brain activity and the brain structures of these, high-level experienced meditators. Then we have, other experienced meditators, but non-monk or Buddhist nun meditators. And then they also look at the brains of people who have taken this famous 8-week training program, which I'll describe in a bit more detail. And then they look at the non-meditators' brains. And they're able to see tremendous amount of quantifiable changes in the human brain that it actually can change and actually can change for the better. So I will be talking a little bit about just highlighting the structures of the brain that have been shown to change with meditation, but just a sort of an overall look at the broad categories of the benefits of our functional benefits in terms of how we feel psychologically, emotionally, how we function in interpersonal relationships, and how we physically are feeling, and also looking more deeply into the physiology behind mindfulness. So psychologically, some of the reductions that have been shown are reduced unhealthy coping strategies or behaviors, reduced stress levels, cortisol levels, reduced anxiety and depression, and increased attention and focus. Who couldn't benefit from more focus? We're also distracted these days. Increased emotional regulation, self-regulation, self-compassion, and resilience. And then in terms of interpersonal benefits, you can see a variety of different sections here. It boils down to this idea that if we ourselves can learn how to develop our emotional intelligence and be more aware of what we're feeling when we're in conversation with somebody, particularly when a conflict is coming up, when we tend to just do the first knee-jerk reaction. If we can enhance our cognitive flexibility and be able to see other perspectives in the situation, express ourselves with focus and with a sense of attunement to the other person, it just stands to reason that it would help our relationships, help us to be a little bit more responsive versus reactive. And so that's really helped me a lot in my own personal life. Although if you ask my husband and my kids, they might think differently sometimes. But overall, it has helped me to really slow down those automatic habits that we would naturally have if we haven't trained in this. Physical pain, it can actually help to reduce the physical symptoms of pain, but how we're also relating to physical pain, glucose and diabetes related to stress. Mindfulness can help improve that area, improve sleep quality. A lot of us could benefit from that, because just when we're trying to go to sleep is when the mind starts to get really busy and replay the whole day over and over and over again. Positive changes with the stress reaction, the physiology of stress. Before I came on here, I was just sitting and trying to work with the physiology and try to be curious about the sensations and really calm the mind's reactions. Improved heart health and blood pressure, and then it's been shown to improve the immunological system. So in terms of the neurobiology of the types of changes that happen through this training of attention, mindfulness has been shown to trigger this positive neuroplastic changes in the brain. So we used to think that as we age, the brain would just simply deteriorate with age. But because of all this brain science, it's actually been shown that we can improve that we can slow down the rate of the age-related changes. And with the 8 weeks of the mindfulness training, it's been shown that how we train our attention can produce very specific changes to the brain. So the limbic system, which for the monks, they kind of light up like Times Square for gratitude and appreciation and bliss and happiness. And again, in 8 short weeks, that part of the brain begins to activate more, to light up and to be more active. Prefrontal cortex, which helps us with attentional control, turning off mind wandering, helping us to problem solve and have self-control, regulation. The prefrontal cortex has been shown to increase in thickness and density in the gray matter. Our amygdala literally shrinks in volume and size, which is responsible for always being on the lookout for stress. So that really reduces in activity. Hippocampus, which is very sensitive to stress and trauma and depression, has been shown to also increase in thickness and in terms of memory and emotion regulation. Temporoparietal junction has been linked with our ability to tap into our sense of empathy and compassion. So they show people images when they're in the fMRI machines, and they can just see when empathy is happening, what parts of the brain light up. And then the insula. So when our mind, the fellow going to the park, when his mind was in that bubble of thinking of all those thoughts, that's the prefrontal cortex, the problem solving. When we're able to move our attention to our feet, our breath, this is the insula that happens, our ability to sense what's happening in the moment. And so I'm not going to go into all the details of these studies, but just to point out that there's a lot of very methodologically sound research to show that a particular program, mindfulness-based cognitive therapy program, an 8-week program, has been shown to reduce the risk of relapse by around 50%. So over and over, these studies show that statistic, and particularly for people who have had 3 or more episodes. So it's pretty fascinating. The second one here is suggesting that MBCT, so mindfulness-based cognitive therapy, has been shown to be kind of on par with when people are staying on their antidepressants. It's been shown to be protective against recurrent depressive relapse. And so we're not suggesting, the disclaimer is we do not encourage anybody to go off their medications, but it's just to suggest that there is some empirical evidence to say that it provides some care against depressive relapse. Other meta-analysis studies, just to show that there's a lot of backing behind this. All of the studies that I'm kind of citing here are based on 2 specific structured manual programs. The first one, mindfulness-based stress reduction. Just by a show of hands, who here has heard of mindfulness-based stress reduction? It's very common. It's evidence-based. It was designed, in 1979, decades ago, to have this sort of 8-week training to help people get in touch with their minds and their bodies in a whole new way. And this course was originally designed for people whose doctors just said, I'm sorry, we can't get rid of your pain. We can't get rid of your chronic health condition. You are just going to have to learn to live with it. And so people came to this training and they thought, mindfulness, like meditation, how is this going to help me? But again, because of all these decades now of science, it really shows that people help improve their quality of life. And then in 2000, MBCT was born. It's a sister program of MBSR, and it was specifically customized for depression and anxiety, originally depression, but to help people prevent a future depression from happening. And so there's a lot of science behind it, and then it was also customized for relapse prevention from substances, mindfulness-based relapse prevention. So why are people craving these mindfulness programs? You can see here all these people feeling overwhelmed and stressed and multitasking and just drawn to their phones. Can anyone here not relate to some of these? If there's anyone here who can't relate, I want to study your brain after this talk, and I want to find out your secrets. But our society has never been more distracted. It's such a strong pull to our phones and our digital age and overwhelm of information. And so so we're on the same page. Because it's gone mainstream, it can be kind of confusing. But the most commonly agreed upon definition is this awareness that emerges from paying attention on purpose to the present moment. And it's in a particular way. So it's with these attitudes of non-judgment, with acceptance of what's happening, and it's a kind attention, a compassionate attention that we're trying to really cultivate. Especially it's difficult when something unpleasant is coming up and is experiencing inside of our bodies or in the situation. There's another good definition here, sort of a little bit different, but she says, to notice one's experience with open-hearted, non-judgmental awareness, no matter the nature of that experience. So what she's pointing to here is, by the nature we mean whether the situation is pleasant or unpleasant or neutral. So having this kind of basic friendliness to all of our moments and not necessarily only going for the pleasant ones. So I like how she kind of adds that into her definition. It is not a religion. You don't have to convert to Buddhism. You don't have to embrace any philosophy. You don't even have to be a spiritual person. It's very pragmatic, really brain training. It's not about needing to feel a certain way. It's not about relaxation, which surprises most people. But it's really just this being aware of what's happening. The problem is that we all have a mind, and when the mind is left to its own devices, it tends to add more stress to our moments. And so the way that it does this, part of the way it does this, is this time travel. This old quote, the past is history and the future is a mystery. This is true, but what happens is when the attention gets sort of pulled into the past, it tends to bring up these themes of regrets, why did I do that? Why didn't I do that? Anger, why did that have to happen? Bitterness, a lot of questioning, why? Wanting to understand, and we would tend to overthink it. If only thinking, and has a lot of depression in the past. When it comes to the future, the mind naturally gets pulled into worries. It's uncertain, so we don't really know what will happen, and our brain loves to try to predict and hypothesize, and unfortunately it goes into fears, overwhelm, catastrophizing, thinking worst case scenario, and a lot of the what ifs. And so we don't even notice that we're doing this. We're kind of on this automatic pilot, not even aware that in the background our mind is traveling every which way. So even now, I'm sure your mind, even though you're intending to pay attention, it wanders. And this is normal, and this is just the nature of our mind. And so a big part of mindfulness is learning how to sort of get out of this autopilot mode and disengage from this time travel, to learn how to wake up. And just the foundations that we're training our attention to be more present, but it's in a very particular way. So it's not just spotlight of attention, it's these attitudes, which I'm going to kind of go through one by one really briefly. These are essential when we're practicing mindfulness. Beginner's mind, has anyone heard of this concept before? Beginner's mind, yeah, it's pretty common, but it's this freshness, bringing the sense of curiosity to our moments. Even if there's a sad mood, even if there's anxiety, can we get curious about this? Can we learn how to change our relationship to it? Can we be patient? Patience is an attitude that has a lot of wisdom in it. And we again tend to want things, we want the answers right away. We want to know how it's going to go. And so when things are not the way we want them, we become impatient and we suffer. So mindfulness asks us to practice allowing things to unfold in their own time. And this is difficult. This is not an easy practice to do, but it does get easier with practice. Trust. Learning how to trust our own inner wisdom is a huge part of mindful living. Learning how to let go of our instant snap judgments of, we say we notice something, we like it, we don't like it. It's a good day, it's a bad day. If a mood, anxiety, depression is here, I don't like this, it's bad. But with mindfulness, this non-judging attitude invites us to drop the label and try it again. If it's here, can we turn towards this? Can we explore this? Can we investigate it? And without the judgment. And then when we notice that we're judging, we just say, okay, don't judge the judging. You just say, oh, there's judging, and see if we can be with the experience as is. It's a little bit confusing at the beginning. Acceptance. So, when we stop the busyness and we learn how to slow down and tune into our bodies, even right now as I'm talking, I'll invite you guys to feel your feet on the floor, feel your breath. If something challenging is coming up, whether you're feeling impatient or bored, or if there's pain that's present, can we practice this allowing and accepting, even if it's unwanted? Non-striving is a thing where we're constantly wanting things to be, we're working on goals, we're changing, we're fixing. Non-striving is letting go of expectations, right? Just having a moment of just letting it be as it is. And it gives us just a balance between our usual striving mode, which is not bad. It's just that it can be unhelpful when it comes to the inner landscape. And then the last attitude that we're practicing is this idea of letting go. So with depression and anxiety, we get pulled up into these stories of harsh self-judgment, and again, this time travel. And we're trying to, if we're getting pulled into unhelpful thought loops or rumination, can we let go of the thoughts, and can we refocus our attention on what's happening? Can we use our breath? Can we use our body? Can we let go of the wanting things to be a certain way? And as we transition to our next speaker, I'll encourage you guys to see what it's like if you can let go of all the stuff that I just said. So just letting go of all those words and all those concepts. And she's going to share her story with us and then guide us in a practice.